accuracy of information presented on this program, Rogers Community Television and all Healthline participants cannot assume responsibility for any false or misleading information. Information presented on Healthline does not substitute for or replace recommendations given by appropriate healthcare professionals. And under all circumstances, personal examination and treatment by medical experts for any health-related conditions must be completed. Information presented on Healthline must be verified with your primary care physician or medical specialist.
Welcome back to Healthline. I'm Dr. Colin Elkin, your host, and we've been talking with my guest tonight, Dr. Mark Mitchell, about spinal health care and chiropractic care. And before the break, we were getting into a little bit about some of the differences with disease versus dis-ease. We're going to talk about the difference between a chiropractic adjustment and a neck manipulation. And of course, I'll remind our viewers that we are live tonight. Please join us this evening. You'll see the numbers flash across your screen. It is a local call right across southwestern Ontario. So please join us this evening. Discuss with us your comments or questions or concerns about anything we've been talking about this evening. We've had a couple of great calls in the first half of the show. And we would like your opinions on a couple of things. First of all, our poll, do you visit a chiropractor? Or the second, actually the more important question, here it comes up on the screen now, do you think chiropractic care is a safe method of spinal health treatment? Okay, so please join us this evening, give us your opinions on that. We're going to be getting in a little more in the second half of our show to the actual safety of chiropractic, because there has been a lot in the media lately about that. So we're going to address those issues. Dr. Mitchell, and again, thanks for being with us. I do appreciate you being here. Discuss, if you will, the chiropractic definitions of disease versus dis-ease, if you will.
I think that's an important distinction to make, and I think that's one word in chiropractic that we use, dis-ease, not disease, which has to be clearly defined, or at least differentiated. I think, again, this is what gets chiropractic in a lot of trouble as far as the media and in the public perception. Oh, you claim that you cure disease. In fact, in Dorland's Medical Dictionary, that's one of the definitions of chiropractic adjustment, that we claim to cure disease. That isn't true. I won't say that. I've never heard chiropractors say that they cure, but that's not what it's all about. Disease is a medical term. It's a medical thing. I would never claim that I could diagnose a disease. I don't have access to the techniques to diagnose disease. We can't take blood. We can use x-rays. We can't use MRIs. You know, we don't have the access to it. And disease is a medical term. And when a medical doctor diagnoses a disease, he has a treatment based on what that disease is or the symptoms or however he does it. Dis-ease is a chiropractic term that was started, as far as I know, with Dr. B.J. Palmer, the developer of chiropractic. Ease means being whole, being at rest, being on a level, being well. Dis-ease means a lack of that, or in Stevenson's textbook, the chiropractic textbook, it states a lack of activity. The purpose of chiropractic is to find nerve interference of the spine, relieve that nerve interference to improve body function. That's what chiropractic's about. Now, and I've said this to other people, as far as does a subluxation cause disease in a medical sense, I don't know. That's going to be up to the research to determine that, and some research is going on that's showing that in the medical community as well. I mean, I talked about Gutman, we got Lewitt in Czechoslovakia, we got Gorman down in Australia, the ophthalmologist doing study about vision. Now, by the same token, when I adjust a spine and correct that subluxation, does that therefore clear the disease process up, medical disease? I don't know. That's a medical determination, not a chiropractic determination. I know when a subluxation is cleared, that body is functioning better. Does that mean that the medical diagnosed disease is going to go away? Some instances I've had patients that have said, yes, it has. But that's up to the medical doctor to determine that. And I think it's important that people understand the difference between disease and dis-ease. Chiropractors are talking about a lack of normal function, a lack of ease, not necessarily disease.
That's interesting. Now, as we talked about earlier in the break, chiropractors don't proclaim to treat any particular disease.
Right.
Can you discuss the difference between, first of all, an adjustment and a treatment, and then the difference between an adjustment and a manipulation? Okay.
In our office, we never use the word treatment. It's an adjustment. A patient comes in and gets checked. If they're off, then if the thermometer reading indicates they're subluxated, we know they're listing, we adjust them to correct that subluxation. An adjustment is a setting right, a rectifying of a vertebra that's out of proper position and causing that nerve interference. A manipulation, on the other hand, according to Dorland's medical textbook, or pardon me, Dorland's medical dictionary, it states in there that it's a maneuver in physical therapy in which we take the joint beyond its paraphysiological space, making sometimes a cracking sound. I think there's a difference between adjustment and manipulation. I do not manipulate in my office. I give an adjustment. An adjustment is based on finding a subluxation, and it's a setting right of that subluxation, removing the nerve interference. What a manipulation is, I don't know. I know it's taking it beyond that paraphysiological space in physical therapy. If you want a proper discussion about manipulation, maybe a physical therapist could tell you better about that. I don't believe chiropractors manipulate. I believe they should be adjusting.
That's a very important point. Now, is it safe to have your spine adjusted?
Yes, as long as the spine has been analyzed correctly. Now, when I say correctly, in my opinion, in my office, every patient that comes in my office, unless, of course, they're pregnant, or younger children as well are difficult to do this, every patient will either get an x-ray in my office or appear with radiographs that have been, radiographs being x-rays, taken by their physician. I will not touch a patient unless there's a reason, like they say, pregnancy or a young child, and I'm kind of reluctant to do that, but I will adjust them because I don't get the accuracy on it that I think I do with an x-ray.
Them.
If they're pregnant, I wouldn't, but everybody else, yes.
As far as a young child, you mentioned you wouldn't adjust them, you would x-ray them.
I try to x-ray the kids. My kids were x-rayed when they were under 2, but of course they were my children, so I could tell them to stand still.
Sure.
Sometimes with children, it's very difficult to hold them in a position that you can get a film. But I try to get films on every patient if I can.
Okay.
And the majority, I'd say in my office, 99.9% of my patients have x-rays that I can use for analysis so that I can determine how I'm going to adjust their spine.
And like you say, number one reason, and we do the same thing in our office, for safety reasons, number one, and 2, to get some sort of an idea of will that person respond to chiropractic care, and in your technique, to get a listing for that patient. And also, too, it helps the patient for them to see their x-rays and give them an indication of how long it may take for them to respond to chiropractic.
I think another important point as well, beside the x-rays, again, we said we do the thermometer reading to make sure they are subluxated. Also, a patient's past history of health is very important. You know, as long as patients are honest and you've investigated correctly to make sure there's not something else going on there that maybe we should leave alone. Even B.J. Palmer said in his in the textbook Subluxation Specific, Adjustment Specific, said he wouldn't adjust spines that have tumors in the bone, tuberculosis, or fractures.
Sure.
I agree with that. I hold to that. But I mean, a health history is very important as well.
Yes, yes. Now, there has been a lot of media, and we're going to open a whole can of worms here. There has been a lot of media attention towards chiropractic, especially in the recent few months, with regard to the issues of, as we say, neck manipulation, so-called, and stroke, the issue of stroke. Can you address that issue first of all?
I think it is. I mean, it is a concern. It's out there. I think most of the information that's going out there is a little bit misleading. I think it's been unbalanced. There was a good article in the Globe and Mail the other day with chiropractic. I didn't agree with all of it, but I thought it was very well presented. It did present a bit on the stroke issue. Chiropractors, we know all about the stroke issue. We've been taught that at school. One of the articles, one of the papers, they said that we didn't know about it. Listen, we're told about it at school. We know that there is something that could be going on in there. The risks of stroke, they've been varied all over the place as far as the ratio or the frequency, anywhere from 1 in 40,000 to 1 in 10 million. So I don't think anybody has any idea what the true rate of stroke is. The Canadian Heart and Stroke Association says the overall rate of stroke in the general population is 1.7 cases per 1,000. That's stroke overall. So
and that's got nothing to do with chiropractic. Let's clarify that.
That's general population. So if we take that, and let's take what I've heard is probably the worst scenario for if they were going to apply it to chiropractic, which I don't believe it applies, 1 in 40,000. So if I don't know whether I'm not a statistician, but I'm going to do it this way. If we multiply 1.7 times 40, correct, to get 40,000,
sure,
that puts it well over 1 in 40,000, doesn't it? And as we discussed briefly before, if you and I are living in the same environment, and you're getting something less than I am, and you're doing something different, I mean, maybe we should investigate what you're doing if it's less frequency. The stroke issue is tough to talk about right now because as we know, there's a lot of things going on, and we can't really be fully let all what we know out there because there's some legal cases that are going on. But as far as I'm concerned, I adjust my children. My children do not take any medications. And one reason they don't take medications is I'm fearful of the undesired effects. I don't like calling them side effects. Dr. Franklin always told us at school, they're not side effects. You've got desired and undesired effects on medication. I wouldn't allow my children to take a Tylenol, for instance, or any inflammatory for fear of a reaction to that child because of that drug. But I have no problem with adjusting my children, my wife, my mom, my dad, and the people I love the most in my life with a chiropractic adjustment that's specific and is done and applied correctly.
So how do you address somebody coming into your office, basically with those concerns? How would you set them at ease?
Basically, I tell them the ratios. Say the rate of stroke in the general population is 1.7 per 1,000. As far as we know, in chiropractic, and it's about 1 case per 2 million. I think that was the CCPA, one of our liability insurers' rates on it. So I mean, it's less than the general population. So in that, when I hear that, if I heard something was happening less, somebody was doing something that was less than general population, it was a desired health effect, I'd probably do it.
Sure.
The other important thing about chiropractic and safety is you can always look at insurance rates to see, you know, the rubber hits the road when it comes to insurance.
Malpractice insurance, sure.
Yes. You probably paid yours. You're the same. I think you're the same carrier
Yes.
I am. What was it? $700 a year?
I believe it's $800 a year.
Yeah, $700, $800 a year. And I don't know medically what it is. Maybe a physician can tell us. I'm going to say $1,000 a month, isn't it?
Oh, it's well beyond $800 a year.
Okay, and then also we got to remember that some of their malpractice is subsidized by the government as well.
Correct.
So I mean, the insurance tables, I think they say a lot. I think that's important for people to realize too, because if it was really as bad as it's led to believe in the paper, we wouldn't be paying $800 a year. Pardon me, dollars.
So it is important to put things in perspective.
I think so.
Absolutely.
I think so. Now to state, the other thing too, just in finishing that, to state that nobody's ever had, I think when people, like my grandfather died driving his car of a heart attack. Well, we didn't go out and sue American Motors because his Rambler caused his heart attack. I mean, people have been to a chiropractor's office and then had a stroke at a later date, but then they haven't been able to find a causal effect there.
Sure.
In fact, Chiropractic Leadership Alliance with Pat Gentempo and Chris Kent have research showing, was it 6 patients that missed their chiropractic appointments and then had strokes because they missed their appointment? And I'm sure you've had cases. I know I had one early on in my career where a patient came in, this woman came in late at night, and I could have been rushed, but I wasn't. I did my chiropractic analysis. She just didn't look right. I took her blood pressure. Her blood pressure was 280 over 180. I told her son to take her to the emergency department. I didn't touch her, didn't adjust her at all until she got checked. She had a stroke that evening. Now, if I'd have done the adjustment, yes.
All of a sudden.
As Fred Barge says, enough said.
Yeah, enough said is right. Well, shall we go on?
Yes.
Which actually brings us back to our poll this evening. Do you think that chiropractic is a safe mechanism of care or mechanism of spinal health care? Well, you know, there's our Healthline poll coming up on the screen. Please join us and tell us your opinions on that. Of course, keeping in mind Dr. Mitchell's discussion on that topic. If you have been to a chiropractor, tell us your experiences. If you haven't been and have some concern about going, please share with us that concern. So join us on the phones this evening. We've got Thomas with us on line 1. Hello, Thomas.
Good evening.
How are you this evening?
Very good. I was wondering, since you don't treat, what would you do for a herniated disc?
That's an excellent question.
It is. Again, we'll go back to some research. Research indicates, I'm 37, and I don't know how old you are, Colin.
Somewhere in
Much
there,
younger,
yes.
of course. The research indicates that I probably have 4 to 5 herniated discs in my spine and don't even know it. I would do the adjustment with a herniated disc like I would on anybody else. Now, it depends, though, on how far that disc has advanced as far as the herniation. For instance, if a patient came in to me and was complaining that they were losing bladder and bowel control and couldn't walk, and along with those symptoms, I would probably recommend that besides getting checked chiropractically, they should visit their physician. But having said that, most people that I see that have serious disc herniations, very few come through my door. A lot of them have usually been to a medical doctor previous to this and usually come in because they haven't got satisfaction that way. And again, as far as diagnosing a herniated disc, it's difficult for a chiropractor to do that because we know probably the best way to diagnose herniated disc through CAT scan or MRI. So in answer to your question, Thomas, if you came into my office and I checked you, I'm sure I adjust lots of people that had herniated discs, and I'd expect you to respond. And since the majority of my patients respond, I would hope you would. If you didn't, then we'd probably send you over for a consult elsewhere. Does that answer your question?
Yes.
Have you ever seen a chiropractor, sir?
Twice.
Okay. On 2 separate occasions or 2 different chiropractors?
2 different chiropractors.
Okay. And so you've been once to each chiropractor, is that correct?
Oh, no.
You've been a few times to each chiropractor. Okay. And you still have this herniated disc problem that's still giving you some trouble?
Yes.
Okay. And how old are you?
49.
49. Alrighty. Have you considered any different types of care, or have you looked into or tried any different types of care?
Just about everything going.
Okay.
One thing I was going to say too, Thomas, if you had a herniated disc in your lower back area, again, with me doing specific upper cervical adjusting, you would only be getting adjusted the upper cervical area. And I know that's kind of tough to get your head around that because you think my problem's in the low back, but we have had referrals from other chiropractors and other people coming to us from referrals from friends who have had chronic low back problems, and the upper cervical adjustment has made a difference. Some of those people, mind you, have been checked and have not been subluxated in the upper cervical area as well.
Isn't there a way to target the low lumbar disc? I know that chiropractors push on them.
I do not. But you're right. I guess some do. I'm not aware of that technique, so I couldn't really make a good comment on that.
All right,
Sorry.
thank you.
Sorry about that.
Thank you very much for your call, Thomas. And you know what? Thomas brings up, again, a very important point. Probably every chiropractor uses a slightly different technique. Even if it's the same technique, there's different modifications of each technique. Dr. Mitchell is an upper cervical adjuster. I like to adjust full spine, and I use what's called a diversified technique. So every chiropractor is different. Some people respond very well to certain techniques. And I have not hesitated in the past to refer somebody to a different chiropractor whom I know uses another technique. Right. And there's dozens, maybe hundreds of different techniques, chiropractic techniques out there.
And people respond to all techniques.
Exactly.
I mean, I a lot of times think it is the confidence in the chiropractor in his technique and his intent with doing
Sure.
that. I used to adjust diversified, and I'll admit there are a very small percentage in my office that I still will use a diversified adjustment on once in a while. I think it's good to know a number of different techniques. Again, I'll go back to my hockey analogy. When I go play hockey tonight, we're all playing hockey, but I can guarantee you no two of us are skating the same or shooting the puck the same. And that's the same with chiropractic.
Yep. Yep. So that's important. And Thomas, I do recommend to you, I hope you're still watching, that just because you have seen two chiropractors in the past, don't hesitate to look around and, look into different techniques. Try another chiropractor who may use a different technique, because that certainly may help you out in the future.
Another thing too, Colin, I think it's important for everybody to realize as well what chiropractic is. It's the removal of nerve interference from the spine. That's, I think, and I tell patients that's what you're paying me for, a special service. Ensure that the chiropractor is doing that. I think that's important. And if he's not, I mean, some chiropractors use different adjuncts with their chiropractic adjustments, but make sure they are adjusting you if you need it. And a chiropractor on every visit should be able to tell you if you're subluxated. Am I subluxated, doctor? Yes or no? How do you know that? And the chiropractor should be able to answer you. Do I need an adjustment? Yes. How do you know that? What adjustment has to be made? And have you been successful in making that adjustment? And I think on every visit, the chiropractor should be able to answer that question. I know I can, and I know you can.
Yep. Yeah,
and that's important.
And that's a great idea.
Very important.
There are chiropractors out there, and we do have to say, there are chiropractors out there who do not even focus their attention on the spine and use different therapies like a physiotherapist would. And some, we have to say, some have great success with that, but that, to me, in my opinion, I know Dr. Mitchell agrees with me, is not really truly the practice of chiropractic. And as you say, the practice of chiropractic is to remove that nerve interference. Right. Okay. Let's carry on. Great question, Thomas, and thanks very much.
Yeah, it was.
Again, you've opened up a whole different perspective on things. We're going to open up another can of worms.
Great.
From a chiropractor's perspective, and we touched on this earlier. We had a question on vaccinations before the break, and that was by Marilyn, and we do appreciate that question. Are we, as a society, from your perspective, over-medicated?
From my perspective, yes. And there was a study from the Ontario government. I was during the Bob Rae, I'll call it the administration, but when Bob Rae was in power, and he said, the Ministry of Health said that on average, over the age of 65, each senior is taking 25 medications, on average. Well, my father-in-law is over 65, and I can tell you, he's not taking any. So that means somebody's taking 50. So are we over-medicated? I believe we are. Do I think the medications are not necessary? No. I think in some instances, people maybe do need medications. There's going to be people with car accidents, cancer, in crisis positions in their health that may require medication. I think the use of medication wantonly, just to suppress symptoms without people understanding what they're for or what their undesired effects are, I think that's dangerous. And that reflects. Don't they say, was it New England Journal of Medicine this year said that more people die every year from anti-inflammatories than die from AIDS? More people die every year from Tylenol than die from crack cocaine? Are we over-medicated? I think so. And I think another important issue about this, and we talk chiropractically, I don't know about yourself, but I think you're probably similar to me. I cannot remember the last time I took a medication. We discussed this previous to coming on the air. 4 years ago, I shattered my leg playing hockey again. Well, I keep playing that sport, who knows? But I shattered my leg playing hockey, my fibula. Now, did it hurt? Sure it hurt. And when I went to the hospital, I had to have plates and pins put in it. But I refused to take medication during that. Now, am I a martyr? No. I just chose not to take it because I wanted my body to have maximum healing. Candace Pert, a PhD, very famous researcher who actually discovered the cell membrane opiate receptors in the cells, she states the use of medication actually suppresses the healing process. That's Candace Pert talking, not me. And another example was with my wife. My wife had a cerebral hemorrhage when she was 10 years old, and she had another one a few years ago. We didn't take any medication. We just don't do it. And we have good health. You know, we don't have ill effects because we're not taking that. But I think people, again, going back again like vaccination, get informed. When patients come into my office and they're on medications, I tell them, get informed about your medication. Know what it's all about. Know the undesired and desired effects. Some of the symptoms you may be suffering from may be as a result of the medication. Sure. Your physicians, I mean, they're aware of that. They'll direct you that way as well. And you can get also software programs, CD-ROMs, that'll give you a list of all your medications and their adverse effects. Right. And I think it's important to become informed. Yep. There's no excuse not to nowadays.
Great. We have Rob with us on line 1. Hello, Rob.
Hi, how are you?
I'm just wonderful. Thanks for joining us this evening. Do you have a question for Dr. Mitchell?
Yeah, I do. I was just wondering, I've been seeing a chiropractor for the last couple of years. I had a subluxation initially, and I've been receiving treatment from him for the last couple of years, as I said. And I think he's a good chiropractor, and he's a really great guy. And my question is that of the people that I talk to that about chiropractic, everybody seems to have the same complaint, is that they kind of help you at first, and then but they want you to come all the time. And in my case, I'm feeling pretty good now, and I know that every once in a while I feel that I do need to be adjusted, and I try to get in and get an adjustment. However, when I go in just for like a maintenance adjustment or whatever, it seems like now it hurts me more than it helps me. I go in there feeling pretty good, and I come out with kind of feeling crappy, my neck and back, and getting spasms. And it takes about a week to settle down to where I was before I came in the first place. And I asked him about that, and I can't remember exactly what he said, but he gave me some explanation of it. And I'm just wondering, in my case, is it worthwhile to keep going if I feel like I'm feeling pretty good?
Well, my opinion on that, Rob, that is a good question. And actually something that I was thinking of, I'm sure somebody was going to ask before I came in. Number one, like I said at the beginning, I get checked once a week. Mind you, I get adjusted. Sometimes I'll admit, sometimes after an adjustment, I may have a little soreness after an adjustment because some tissue's been stretched. I mean, you're putting an intervention in there, the tissue could react. I think the biggest thing, if you were presenting to my office, and I don't want to place my values upon your chiropractor, if you were having that kind of reaction, I don't know how frequent are you going to see him on your maintenance schedule?
Right now, probably I've been going about every 2 months or something like that.
Well, number one, you wouldn't be coming to me every 2 months. I would expect a patient that saw me every 2 months would probably react to an adjustment. When BJ did his research, he said after about 29 days, the spine tends to scar, and you might be getting a reaction because of inflammation because of the scar tissue breaking up through the adjustment. Having said that, though, if you were having what I'd call a reaction to an adjustment, I don't know the last time you were x-rayed, I'd probably do a re-x-ray on your spine, the upper cervical area in my case, because your listing may be changing, and as a result, the adjustment may have to be changed, might have to be altered or modified. I think maintenance, or what I call wellness adjustment, is important. I think feeling good is part of it. I look at not chiropractic as being, I'm preventing a problem from coming on, but getting me as healthy as possible. It's why I eat organically. It's why I drink lots of water. It's why I exercise regularly. It's why I try to keep a positive mental attitude. So the philosophy there is important as well. And you look at just about everything. There's only one profession I know that probably doesn't promote a maintenance type approach. I mean, I maintain my health. I get my oil changed in my car every 5,000 to 7,000 kilometers. I get my furnace checked all the time, so it'll keep working the way it should. My suggestion to you, though, is to confront your chiropractor about it again, and perhaps that he should maybe take a re-examination of you, because maybe the adjustment has to be changed. Also, once every 2 months, I mean, I couldn't imagine going once every 2 months. I'm sure if I got adjusted once every 2 months, I'd be probably pretty sore afterwards.
Well, and that's probably a good reason why you're pretty sore. Great analogy, actually, and I use this all the time with patients. If you've ever worked out with weights, people know if they work out with weights, generally after the first adjustment, you're going to be pretty sore. And or generally after the first workout, you're going to be pretty sore. But as you continue with the weights, your body becomes attuned to that and starts to adapt to that, and you won't be sore. If you wait for a long time, if you stop working out or stop exercising or doing whatever you're doing, and people know this, people that work in their garden first time in the spring, generally they're pretty sore because it's something they haven't done for a long time. You're straining different tissues, straining different muscles. So the period of 2 months between your adjustment, frankly, is too long, and it should be adjusted more often. And I bet if you recall, when you were going a little more frequently to that chiropractor, you didn't notice that after your adjustment. After a while, perhaps after your initial complaint had subsided, those adjustments actually just felt good and you felt well afterwards, until the adjustments started spreading out as far as a time frame goes, and then you start noticing some soreness afterwards. And that's a telltale sign that your adjustments are too far apart.
Another issue, Rob, are you still there?
Yes, I am.
The other thing too is I'm sensing, I may be wrong on this, that you might be a little worried, like you'd like to kind of get away because you're not feeling satisfied with what's going on, but you don't want to, shall I say, hurt your chiropractor's feelings? Like you don't want it, you'd like to kind of stay with them, but not maybe the way you're doing it right now?
Well, I got to make one point. I had been following this schedule of, once every 2 months. Actually, even there was a period there when I hadn't gone for 6 months. And it hadn't been a problem, but it's just recently that the adjustments are starting to affect me this way.
I mean, if a patient had that in my office, and as a result of this show, maybe there will be. I think you should confront your chiropractor. I have no problem with a patient coming in discussing that with me, and I think maybe it's time for a re-examination. And when was the last time you were re-examined?
Yeah, I think it's been too long, probably.
And he'd be happy. He'd be happy to do that too.
Yeah.
Rob,
he's
I'm going to let you go.
Talk to. I have no problem there with him. He's a great guy.
Rob,
thanks for your call. I'm going to suggest you talk to your chiropractor about that. We're going to get to one more caller, and that's Karen with us on line 2. Hello, Karen.
Hi there. Yeah, I have a question for Dr. Mitchell.
Yes?
Go right ahead.
It's regarding treatment for fibromyalgia. Now, someone that's gone to a chiropractor before for a condition of a disc and then diagnosed as fibro,
yes.
Would you treat them differently, or is there a procedure or a different style you use on someone with fibromyalgia?
Okay.
Because
Great question.
the pain is so severe.
Karen, I'm going to stop you right there. We've got about 30 seconds if you can answer that very quickly.
Okay, I'll try to be fast on this, Karen.
Okay.
Basically, an adjustment is an adjustment. Whether you got a disc, fibromyalgia, whatever. If you're subluxated, we want to get rid of that nerve pressure. I've looked after lots of people with fibromyalgia. We've had excellent results with it. I know what you're saying about being worried about getting adjusted because it is a painful condition. So, I mean, with our technique of upper cervical, I don't seem to find problems with that. But should get adjusted and check to see if it's subluxation. But the treatment doesn't change whatever your health condition is.
Great. Karen, thanks very much for your call. I'm going to have to stop you there. I apologize for that. We got to get to our poll. We are in favor of 75%. People do believe that chiropractic is a safe form of care. Hopefully, after Dr. Mitchell's explanation, the 25% that don't have some insight on that. I'd like to thank you very much for joining us this evening. Very informative show. We'd love to carry on. I'll see you next week on Healthline. I'm Dr. Colin Elkin. Good night, everybody.